So I think that the overall sensation of irritation and the foreign body sensation or that discomfort on the initial night, I think that goes for both procedures by the next day. I think that with LASIK, anecdotally, most of my patients just need to use a lot more lubricants and drops for a longer period of time than my SMILE Pro patients. I think with both categories, LASIK and SMILE Pro, because we're disrupting the tear film, at the end of the day, we're having surgery, we're using drops. So we're pretty careful because I'm a corneal specialist. At our clinic, I make everyone get customized preservative-free post-operative drops. So everyone's on preservative-free antibiotics and steroids after their surgery, and we get those custom made through a really great pharmacy that works with our clinic. So I think that already reduces some of that burden because you're using preservative-free drops, and then also my patients use regular preservative-free lubricants after the surgery. So we do what we can to minimize it, but I do think that with LASIK, you will feel those dry eye symptoms. Some people will feel those dry eye symptoms for a bit longer than SMILE. I'm talking months. I'm not talking extended. Usually by the 3 month mark, you return to your baseline, so what you were previously. So it's usually a short period of time. And as I said, there's been a large meta-analysis, so a large study that's looked at SMILE and LASIK after a year, and the dry eye symptoms are very similar. So I don't think that this is a major factor for most people because we very carefully screen patients. So if patients have severe dry eye, they usually don't have laser, they're not candidates. Or you have to pre-treat them with IPL, so intense pulse light therapy, or you have to pre-treat them with a cyclosporin drop. So or you have to use those things again post-operatively if they're a slightly higher risk candidate. So we're very careful with our dry eye assessment, and we have to see how motivated patients are. So if someone does have some dry eye, but that we know that they're going to use their drops well and they're going to tolerate other treatments in addition to the laser and they're prepared mentally to do that, then they're not ruled out from having laser surgery. And I've had very successful people who I've treated their dry eye and they've had laser surgery and they've had a great outcome from their laser. But I think for the standard person, if they do have very bad dry eye, it's generally contraindication to laser, but it's not always. I think it's just important. And again, that's because I'm a dry eye specialist and a corneal specialist. I can make that call. But as a general rule of thumb, it's one of the things we look at very carefully before people have laser. And then that might change what we do. They might end up having implantable Collamer lenses, so ICLs instead of LASIK or SMILE. If they've got really dry, we don't think that they're going to have a good outcome. One of the ways that you can also assess is how stable their refraction is. So usually people with very dry eyes do not have stable refractions. Like their scripts are not stable. They're usually all over the place. Their vision fluctuates. It's all a bit of a mess because their tear film is unhappy. And that's another way that we can determine suitability.
So you said that usually you do the laser surgery operations on a Friday and people are ready to go back to work on Monday. Do the eyes look red? Like should people wear
Oh no.
sunglasses for the first few days afterwards to hide their eyes? I mean, does it just look natural?
It's actually pretty unbelievable. So LASIK and SMILE are the same in the sense that so that day patients come out of surgery, you're tearing, you feel like crying. We provide you with a little pack which has sunglasses in it. So we have all that sorted for you because they're prescription-free sunglasses because you won't need a script. That's the whole
Mhm.
point. So that day when you have the surgery, you'll definitely feel light sensitive, you'll feel very teary, you'll feel a bit uncomfortable, and then you just go home and you sleep. And then when you wake up the next day, it's literally like you've never had surgery. Your eyes are white. So again, the type of laser we have, it's not a scleral suction laser. So some of the other ones are. So we really very rarely get red eyes. So like that's basically called a subconjunctival hemorrhage. That's when one of the little blood vessels on the surface of the eye is disrupted. So we really don't get those with the Zeiss lasers just because it applanates the little head that sits where the laser is actually just sits directly on the cornea, and the cornea is avascular. So we really don't get that with our lasers at all. I can't remember the last time I had one. So that's good. So the eyes are white. So that's a good, nice for the patients. And also, it just doesn't look like you've had surgery at all. from literally the next morning.
All right. Well, and okay, so what about in the month, sorry, the weeks or the months after that? Do they have to come back to you for like follow-up checks? Should they, also be seeing their local optometrist during that time? What does it look like?
Yeah.
What does that process look like?
Yeah, so they have the surgery. We always see them the next day, and that's just to check the position of the flap or just to check that everything's looking good after the surgery. Sometimes with Smile, the option is to see us a few days later. That's fine. But LASIK, I always see the patient the next day just to check their flap. So there's usually around a day one assessment. There will be an assessment around 1 week, 1 month, 3 months, and 6 months. Anytime during that period, they're also welcome to see their own optometrist. We can do collaborative care we do that with some of our local optometrists. We also do that with some of the patients that are traveling from far. So I have patients that come from Queensland. I have patients that come from the Central Coast, just from all over New South Wales, Canberra, especially for things like Presbeyond, because lots of places aren't doing Presbeyond. So for those patients, we definitely work in, collaboration with the local optometrist from where they're from to do some of these assessments. But patients are always welcome to come to these assessments. They're kind of like our compulsory assessments. And then depending on geographic location, we can kind of be a bit flexible. But that's the setup. And then we see them at 1 year. And then generally at the 1 year mark, we discharge them back to the care of their optometrist for annual health checks. So anyone who's had lasers should still be assessed annually for their forever. Because it's just good to check on the health of the laser, but also the health of the eyes. Lots of these patients, you've got to remember, have very high scripts. That's the whole reason that they want to get out of their glasses, So they're very short-sighted, and short-sighted patients have a whole host of issues that they can get separate to laser. They can get glaucoma, retinal tears, retinal detachments. So it's very important that these patients don't forget that even though we've corrected their script, they've still got myopic or short-sighted eyes. So they still need to see their optometrists annually, and they still need to make sure that, they're keeping really good overall eye health.